So there's actually a few issues. So I have the implant I need to have done, and then there's
Okay.
kind of the bottom teeth are a little bit misaligned, so I just need to
Okay.
straighten them out. And then I do have
Okay.
some cavities and cleaning I need to have done. So I was living in the Philippines for 4 years, so I didn't get a lot of stuff done when I was in the Philippines. So I just moved back,
Okay.
so trying to fix all my teeth since I got back.
Okay.
Yeah, I want them
No
to look
worries.
like you. You have a good teeth. You have good teeth.
I appreciate that. So let me just summarize everything. So you're
Okay.
back in the country. You were here before you went to the Philippines?
Oh yeah, I'm born and raised in Vancouver, but
Okay.
my wife's Filipino, so we lived in the Philippines from 2008 to 18. Sorry, 2018 to 2022, 4 years.
Okay.
Yeah.
So you're back home,
Yeah,
Canada home now.
that's right.
And so you want to obviously get a couple of things done, check up on cleaning, fill any cavities that need to be filled. You have a missing tooth somewhere that you want to get replaced with an implant.
See it?
Yeah, I see that.
Yeah,
Okay.
that one up there.
And then and then when was that tooth taken out?
Actually, so it's a long story, so I'll kind of give you a brief synopsis. So, when I came back, I think I had a cavity that I built up, and I didn't heal it in time. So then, when I was biting the chicken, it broke. So I went
Okay.
to the emergency dentist, and they said it's unsalvageable.
Unsalvageable.
Yeah. So then it was.
Or I'm glad they used unsalvageable, not the word hopeless.
Yeah,
'Cause
it didn't say hopeless.
That's another technical term, hopeless.
Oh, okay. Yeah, basically it was unredeemable, if you want to call it that. So yeah, they removed it, and then it's been,
Okay.
I think it was like, I'm trying to remember the exact date. Maybe like July 25th ish, around that day, end of July.
Of this year?
Yeah, only like about 5 weeks ago, 6 weeks, something like that.
Okay. Sounds good.
Yeah.
So, I'll give you sort of a summary of. Can you bite down? Just go like this. Yeah, come closer so I can see. Okay. Yeah, you've got some cross biting. You've got some malalignment on the bottom. I can see. Okay. Okay. So what I sort of see in this brief sort of discussion is you've got a space that you want to get filled.
Yeah.
And aligning the teeth in their proper position will be beneficial before the implant goes in, because you want to make that spot the most ideal for an implant. The space dimension is critical.
Okay.
So if you do an implant prior to moving teeth, you're almost handcuffed. You cannot move that implant. So the way you're sort of looking at it logically is the best way to do it. Now, we can do a records appointment with you, which is the next step. The records are basically a scan of your teeth. We would take an X-ray of your teeth, a panoramic X-ray. We would do photos of your teeth, and we can come up with a plan of what needs to be moved where. So as you mentioned, the lower malalignment gets fixed, but you'd be surprised there may be some beneficial movement on the top that's needed as well.
Okay.
Okay. Now, before we start doing the Invisalign treatment, we would need to sort of take a step back, do a checkup and a cleaning,
Okay.
and diagnose any work that needs to be done, because we don't want to repeat what happened to that upper left tooth. We want to treat early on so that we can treat and be successful.
Yeah.
So then we would do a checkup and a cleaning, any potential dental work that needs to be done
Okay.
before the Invisalign is done, because we don't want to move teeth that have any active infection. Any small cavities, yes, we can sort of delay it, but for the most part, any big cavities, any infections need to be addressed. So we get to the point of doing the checkup and the cleaning, doing any fillings that need to be done, then we would rescan you, because that scan that we do after the work is done is going to be the most precise, best custom fitting aligner scan.
Okay.
So then we would scan you, and then we would get the aligners made to move forward. Okay? So now, Ricky, there's two ways of doing it. One way is first just get an idea about what the Invisalign will be like. I've already given you the cost of $45.79,
Yep.
but I can then show you what the end result will be.
Okay.
So we can do the records first, and then I'll have you come back after I analyze the records about a week or two later.
Okay.
I can show you this is where your teeth will move, and this is how we're going to keep that space open for the best implant.
Okay.
You can then say to me, no, this isn't something I want to do, and then that's the end of the story, right? Or you say, yeah, you know what, this is something that I see would be beneficial to me. I like the end result. Then you say, what's the next steps? The next steps are to do a checkup and a cleaning and do any fillings that are needed, and then go back and get the aligners made.
Okay.
Okay? The alternative way is to do a checkup and a cleaning, get everything done, because you know it needs to be done, but it's, you know, there's a bit of a leap of faith of you coming to me. But I've been, you know, I just actually did the math. I did the math today. September 11th, 2006 was my first day as a dentist.
Okay.
So, you know,
it's like a bad day in human history, right? A bad day in human history, but a good day for you.
You know what? It's incredible because I'm Canadian.
Yep.
I'm turban.
Yep.
I went to NYU the year after 2011.
Okay.
Sorry, 2000 and what is it? September 11th, 2000 and what was it? 6?
No. It happened in 2001. 1.
Yeah, 1. I started dental school in 2002.
Okay.
10 months later.
Okay.
So I was in Manhattan right after 9/11, literally.
Okay.
So not only was that a little bit concerning to me, but then I actually started working in the States. So I was a dentist who started working in the States. So long story short, you know, I've been working for however long that is, do the math, since 2006.
Yeah.
And so the second way of doing it is
17 years. 17 years.
Check up and a cleaning. Sorry?
17 years.
17 years, yeah.
Happy anniversary today.
Yeah, thank you. Yeah. It's a little bitter. It is bittersweet to be frank. Right?
We should have a cake together, a 17-year anniversary cake.
I'll wait till 25.
But we'll make it a vegan cake because it's healthy for us and good for our teeth.
That's okay. You know what? I like the I like the Save on Foods cakes. Those are the good ones. You know, they're not vegan, but they're really good.
Well, they're good for you because you get a lot of patience through them.
I eat them myself, so it's all good.
Okay.
But as I was saying, the second option is you come in, we do a checkup and a cleaning, we figure out what's going on, we get that fixed, and now we're ready to move forward with the planning, the case presentation, and then executing.
Okay. What about the implant first, though? Like, isn't it good to get the implant done because there's kind of a gap, and then I don't know if it can get infected and stuff like that with the implant.
Yeah, you know what? It can be done, but it really is best to wait.
Okay.
If I was going to do it on myself or anyone else, I would say wait. But now we can take care of your aesthetic concerns. With the aligners, we can make it look like you have a tooth there, okay? So it's not like you're walking around with a gap.
Yeah.
And the reason why it's better to do it after is because the teeth in that area are going to move.
Okay.
And you want to move them in the ideal position so that when the implant is put in by the surgeon, I don't do the implants, but when the implant is put in by the surgeon, the implant is basically parked into the proper spot without having any problems.
You got a little kid there too, eh?
I got 2 little ones.
Can I see the kids? Can I say hi?
Elahi?
I have 3 kids. My kids are 11. Yeah, mine are 11, 9, 7. How old are yours?
We have 2 kids.
How
6
old?
and 3.
Hello. Okay, say hey.
Hi.
Okay, say hey.
She's
cute.
shy.
You're being the work from home dad.
Today I am. My wife's at work, so
nice.
you know, when I was saying let's try to figure out a time.
Hello. Too bad my daughter's not here right now, but my daughter's 11 and then my sons are 9 and 7. So not too much older than her. Yeah.
Yeah, no, I've got a 6-year-old and then this is a 3-year-old.
Yeah, very cute. Yeah.
And so you know, it's better to do if you really have your mind set on aligning the teeth properly. Yeah. It's better to do that than do the implant. Okay. If you were on the flip side and you said, you know what, I'm fine with how my teeth are. I don't really mind how they're, you know, chipping and breaking because of the bad position. Then there's a lot of people that just do the implant and then leave it the way it is. But it's not the most ideal way to do it. And
then the implant, you said you're going to outsource it. Is it where's the actual person? Who or where is the person?
So you know what? I generally refer to 2 oral surgeons in the area. One is there's Dr. Gurn near Metrotown Mall, and then there's also Dr. Guriwal in Vancouver near the Oak Ridge Center.
Okay, okay.
Now you can go to anyone, and there's no obligation.
Yeah.
I don't do them myself,
Okay.
and so I can help you, to go to a certain person. But if you've had an experience or you know of a friend who's been somewhere and has had great results, you can go to anyone, really. I do the crowns after, once the implant goes on.
Okay, got it.
And it's ready to have a crown on, I can do the crown.
Okay.
I do the restoration, but I actually don't do the actual implant.
Yeah, okay. Do you know Vancouver Perio?
I know Dr. Vancouver Perio, that's Dr. Verdi, right?
Birdie, he's an Indian doctor too, right? Dr. Birdie.
Yeah.
I think about going...
Dr. Zokol.
Yeah, sorry?
Yeah. It used to be Dr. Zokol, but now Dr. Verdi's got it.
Yeah, I think he'll doing it there, so you recommend them too?
Oh, he's great.
Okay.
He's great. He's a dual specialist. So you're getting best of both specialists, a periodontist and a prosthodontist.
And then the other two you mentioned, Dr. Gurn, and then the other one, Dr. Guriwal, right? Guriwal?
Yeah, Guriwal.
What's the difference between them and then this other Dr. Perio? Sorry, not Dr. Perio. Perio.
They're both very, very experienced. Whichever one you go to, you're going to have great results.
Okay.
Dr. Verdi is a gum specialist.
Okay.
So they can do a little bit more gum sort of maintenance and manipulation if that's needed.
Dr. Guriwal, right?
No, Dr. Verdi.
Oh, Dr. Birdie, the same, the Perio.
Yeah, he's perio and prosto.
Yeah, that makes sense because, I mean, I have diabetes, so my gums affected by diabetes too.
Yeah.
Okay. So I could go to Dr. Birdie, and then you would do the crown and the implant. Sorry, Invisalign.
I would do the crown and the Invisalign, and then they would do the actual implant surgery.
Okay, I understand. Okay. And then your rates are like a flat 5,000 almost, right? 4,799.
Yeah, 4,579, exactly.
That's just a flat regardless of what needs done. And then how about like things like we talked about the cleaning and then the cavities. You do that as well?
Yes, we do. Yeah, we're a general dentist, so we'll do all the checkup and the cleaning, and then we'll do any fillings that are needed.
Okay.
If there's any root canals, we do it. Like there are some rare circumstances, if something is just too complicated, we would refer out, but we try to do everything in office.
And it's just you or the other dentist there too?
It's me that does the Invisalign. There are other dentists in the office that do general dentistry. There's a hygienist that would do the cleaning. So we're comprehensive in that way.
Okay, and then you mentioned coming in and doing the records. How much will that cost, the records?
So we don't charge for the records. It's a service we provide just so that, we want to lower the barrier for patients. If you're really interested, we want to give you the opportunity to get someone to talk to you about it.
Okay. Is that you or somebody else?
Sorry?
That will be somebody else? Like
No, so my assistants would do all the record taking.
Okay.
I would be the one who would analyze the records.
Okay.
Plan the case and execute the case.
Okay. Yeah, so let's do that. Let's do the records. When would I do it?
I'm there Thursdays and Fridays.
Okay.
So it's one of those things that you have to be sort of flexible in your time.
Yeah, I think what happened is I got a Facebook ad, and I think I booked in person. I'm not sure. I'm going to check my calendar. I got confused because I think I got a Facebook ad, and then I signed up something, and then I don't know. I'll check, and then are you going to ask them to call me, or what will happen next?
Yeah, I will get them to call you.
Okay.
Most likely they'll call you tomorrow.
Sure.
I'll forward your information to them, and then they can give you a call.
Okay, let's do it that way then.
Okay, sounds good. Thank you.
So we'll see you this Thursday or Friday, I guess.
Yeah, whatever. I don't know what the availabilities are, to be honest.
Okay.
They'll call you, give you the availability, and then whichever works well for your schedule, they'll book you.
Okay.
If it's this week, great. If not, then it'll most likely be next week, right? I don't have the schedule on hand.
Yeah. But then someone else is there Monday, Tuesday, Wednesday?
Someone else is there Tuesday, Friday, Saturday. They're Tuesday, Wednesday, Saturday.
Yeah, but
We're not open Monday.
They don't do Invisalign.
No, they can do the records, so you can probably go in on the day to do the records.
Oh, okay.
I will then see you on the Thursday or Friday to do the case presentation.
So it's just better just to do the Thursday, Friday, so I can do everything at once.
Yeah. Okay. Yeah, 100%.
Okay. Yeah. Well, so yeah, I'll just wait for the call tomorrow then.
Okay, sounds good. Thank you.
Okay, thank you. Bye-bye.
Okay, have a good night. Yeah, bye-bye.